Good afternoon once again. Today is Tuesday, the 19th of January 2021. I'll start off with the summary that Dr. Tuisin, the spokesperson, had delivered just now. It's very important. Starting off, of course, with the premise that vaccines will build a lot of more immunity, stronger immunity for us. Now, Thailand, like many other countries around the world, some have procured, some have received the delivery of vaccines. The clinical trials are very important to ensure the efficacy, verify the confidence in the vaccines that we will be receiving. Now, in terms of timeline, whether it's next month as planned, or for some countries later on this year or next year as planned, as planned or not planned. Now that's about the vaccines. But the point is that with the understanding that vaccines build immunity, the more important issue right now, the real vaccine right now that we should be focusing on, of course, is on the preventive measures, our own personal protection against COVID, which we have been talking about for many times already. So notwithstanding the arrival of the vaccines, the preventive measures, the DMHTT, and all of these things that we do to take care of each other are even more important right now in order to prevent the spread of COVID. And in the meanwhile, the vaccine, clinical trials, the procurement, the distribution, that will be forthcoming. The spokesperson also talked about the general situation in Thailand. We're in 3 points of concern. First is, of course, the cluster in Samut Sakhorn, which had hit us at the end of December until today, which is called the new wave. Now, the second point is in Bangkok, the cluster in Bangkok. And the third is the situation in our neighboring countries. So these 3 areas are basically what will determine how and when and how fast we will be able to contain the new wave of COVID in Thailand. I'll move on to the general situation and the number of cases that we have for today. For today, we have 171 new cases, most of which 125 to be exact, of which are from active case finding, 33 from local transmission, and 13 from within the state quarantine system. As per the active case, the current active case that we have at the moment in Thailand, we have 3,168. So a little above 3,000 cases of persons still having COVID in Thailand. The cumulative number from the very beginning of last year until now, the cumulative number that we have is 12,594, as you can see on screen. New recoveries, 150. The total cumulative recoveries is 9,356. But of course, the key number for today is a little bit over 3,000 people still remain with COVID in Thailand, and of course being treated in the appropriate medical facilities. No additional fatalities. Some observations from the presentation by the spokesperson just now. Firstly is about the active case finding, which we will continue to carry out this mission. Active case findings will be continued in the various factories in Thailand. We will also be focusing on around 600 factories per day, at least with 50 targets, 50 checkups at each factory, depending, of course, on the number of people in each factory. So that makes around 30,000 targeted cases through active case finding per day. So you see some images on screen of the officials conducting temperature checks and performing their checks and everything in various factories that have been in our target. So the spokesperson also showed a map of the number of factories in Samut Sakhorn province. So there is that plan to go to all of the factories and conduct this active case finding from time to time in order to root out and bring out the number of cases that are hidden that wouldn't otherwise be known if not for active case finding in Thailand. So In the general picture, there still remains 61 provinces infected with infected persons, same number as yesterday. The spokesperson also talked about a particular district in Bangkok, which is on the western side of Bangkok. It's called Bang Khun Tien. So Bang Khun Tien district is actually one district in Bangkok which has found the most number of infected persons in Bangkok, partly due to the existence of pubs and bars in that area, which are actually frequented by persons coming from nearby provinces or provinces in the vicinity of Bangkok. So Bang Khun Tien in the western part of Bangkok, on the map that was displayed, it was in a darker color, I think darker purple. The southern provinces also was mentioned by Dr. Tuisin, wherein while we still have not a high number of risk in the southern provinces as compared to other regions, the southern provinces still have to be on a very, how shall I say, a vigilant lookout because of the high number of cases daily in our neighboring country in Malaysia, around 3,000 to 4,000 cases daily in Malaysia. So they would have to be on the lookout. The active case finding, the strict screening, has been performed in points of entry. For example, in Hat Yai airport in southern Thailand, as well as other points of entry in the southern region. So moving on to the additional information that I'll be providing. First is about the economic impact of the wave. So despite the new wave, the Bank of Thailand has come out with, they had a media briefing the other day, and they came out with an estimation that the economic impact of the situation will be more or less milder than that of the first wave, the first outbreak. So the Bank of Thailand stressed that although in this new wave, the COVID is spreading faster, but the government has been doing its best to maintain the economic activity by ensuring preventive measures against the outbreak that is more flexible, I would say, for businesses to be able to operate. And fewer businesses have been suspended compared to the first wave of infections. While this time around, the exports have continued to expand in line with international partners. So at the same time, the timeline for vaccine development in Thailand and around the world has become more or less clearer with a plan for every country, leading to more confidence for a stable prospect for the economy of Thailand and for the region as well. So you have an infographic there, and I believe on the social media and website of the Bank of Thailand, you can search for more information regarding this analysis on the estimation of the milder economic impact for this new wave. Another point is on the vaccines, and the spokesperson had mentioned this regarding the concern of certain news reports around the world about the fatal side effects of persons receiving vaccines in other countries, in foreign countries. The Minister of Public Health has revealed that any vaccine submitted for approval in Thailand will be vigorously tested by the Food and Drug Administration and the Department of Medical Sciences before they will be released to the public. And hence the public can be rest assured that the procurement of COVID vaccines in Thailand will be safe. And as I mentioned before, the Prime Minister had reiterated this, that unless it is safe and unless it is tested, we will be assured of this, the safety of the vaccines. That's the most important issue that we take to heart regarding the procurement and distribution of vaccines in the future. So the first batch of vaccines, of course, will be approved for the medical personnel, for the emergency use. We have planned to efficiently regulate the use of vaccines and expecting to launch the vaccination campaign for people in the country in due course, perhaps, of course, after the first batch, maybe around May or June. The Oxford AstraZeneca vaccine is reported to be the first vaccine that is approved by the FDA this week. Meanwhile, just to call your attention to the speech, the opening speech by the World Health Organization Director General at the 148th session of the WHO Executive Board. Dr. Tedros, the Director General of the WHO, underscored the need to address inequality among nations. This is regarding vaccines and the prioritization of those who are most at risk for the inoculations. So just to put this in perspective, that of course it's like, perhaps personally I would say that it's like comparing to if you go shopping. If you have money to buy things you need, shopping, but you don't really need it as other people, then that's something to consider. So perhaps just speaking on, not in terms of differentiating between the needs of people, because everybody would need vaccination, that would be very important, and not to differentiate or distinguish or discriminate at all in terms of developed countries or developing countries, but just to take into consideration, I think that's the gist, the point of this opening remark, that inequality in terms of access is prevalent in anything that we see in the world. And prioritizing, I'm sorry, that was a mouthful, prioritizing those who are most at risk for inoculations, that's very important. For Thailand, we have generally set up that as prioritizing those who are in the medical profession, those who are at risk in the front lines, as well as the vulnerable groups, those in need with health conditions, the elderly, the vulnerable, and those groups. So that's what I'm trying to reiterate and relate it and link it to the address by the World Health Organization Director General. So the Ministry of Public Health also stresses about the group of the elderly as a high-risk group. So the Health Ministry reiterated that the elderly is, for us, for Thailand, is a high-risk group and would usually get severe complications after being infected. And most are usually infected through family members. Some might neglect strict self-imposed prevention measures at home after visiting risk areas, for the elderly. So advising for the public to respect such measures, that is, it is the most effective vaccine, in quotations, to help prevent the elderly from being infected, the various important measures. At the same time, emphasizing the importance of nursing homes to implement stricter prevention measures and prevent further transmission among the elderly. The various businesses in Thailand, such as restaurants, have also been asked to cooperate and observe the prevention measures strictly to help stem the spread of the virus within our society. So with particular emphasis on at-risk groups, the elderly groups in this regard. So just a few points before ending. That, of course, no, it's not a one-man show. Nothing is a one-man show in the COVID world. It requires the help of everyone, every sector of society to get through this tough time together. We have to join hands and do whatever we can. Excuse me, on screen soon, we'll be having an infographic in English and in Myanmar language on how migrant workers can keep themselves safe if their jobs are being affected by COVID. Now, this infographic is among the various infographics created by the International Organization for Migration, or IOM, in collaboration with Thai local and other international agencies to provide workers with information and knowledge on COVID and how to better prevent themselves from being infected. I encourage everyone and those who are employing workers, migrant workers from our neighboring countries to make use of this information, which can be found on mitthai.com. I mentioned that yesterday, this website, as well as the website portal of the International Organization for Migration as well. You see on screen, that's in Myanmar language, and it's also available in the other languages of our neighboring countries. So, as always, stressing once again, everyone to wear your face mask, wash your hands constantly, rest assured, when we come to the CCSA, when we have the many CCSA meetings that the spokesperson mentioned this morning, or in where the Prime Minister had, we always wear these while we discuss in our meeting. And only when I and Dr. Tui Sin or the other spokespersons come to the podium, then we take off this very important mask. So this is all I have for today. Thank you very much for your attention. I hope you have a fruitful and healthy Tuesday, and we'll see you again tomorrow. Thank you, and สวัสดีครับ
ครับขอบคุณนะครับท่านณัฐพานุนพคุณนะครับ